Hey, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation. And joining me today, I have the business lead for Pfizer's global antiviral franchise, JoyL Silva. JoyL, it's a pleasure to have you here.
Thank you so much, Jessica. I've just been waiting for this day to be on your show. I'm a huge fan, so really appreciate the opportunity. Can't wait to chat.
Right. So sweet. Thank you so much. So, for those who are not familiar with Pfizer's global antiviral franchise, I mean, it's probably right now best known for Paxlovid, which is the COVID-19 treatment. So, what we're going to do here, for those who are interested in hearing about it, is talk a little bit about the innovative things that you've done and built around the direct to patient relationship for Paxlovid, and how this is also like an indicator of maybe some things to come in terms of consumer connection and consumer innovation and patient journey and patient engagement innovation coming out of Pfizer. So let's start the story here, because I think that this is really an exciting idea. And in particular, how you've built this consumer platform around COVID-19 treatment. So I think, we all wish COVID was over, but it is most definitely not. And for those 275 million Americans who are over 50 or overweight or have a chronic condition, it could be pretty serious. And so the treatment that you offer, helps make an impact on the severity of symptoms, also helps reduce hospitalizations, but people have to move fast. And so here's where this innovation story really starts for me, JoyL. And I want to hear about what you've built and what you've put in place in order to expedite that time from test to treatment. So why don't you start there? Let's pop the hood and let's talk about what you built underneath, this patient journey to help support the fact that somebody's, got a positive COVID test, they've got to move quick to get treatment for it. Now what? All right, tell us what you built.
Yeah, no, thank you so much. So, what's under the hood? Well, I can tell you it's like a whole lot of very committed colleagues here at Pfizer to bring a lot of these innovations to market. So, I'm happy to discuss today. I feel like what has really been a collaborative effort across not just only our company, but as we'll talk about today, many partner companies. So, first, it's pretty remarkable when you think of what we've learned across the pandemic in terms of our response. I know from a antiviral perspective, to date, we've had over 11 million patients just here in the US treated with Paxlovid. And so when you really think about, a patient becoming positive, a patient having risk factors, a patient getting a prescription and making that a seamless transition, that was our goal. And early discussions, even whenever I first came into this role with the team and everyone was explaining, okay, here's what the product can do, but like, here's how quickly things need to happen. It was such a daunting challenge of making sure every piece really lined up effectively. And so what I'm really proud that we were able to do was keep our focus on the patients. It's something that we try very, very hard deliberately to do here at Pfizer every day. And I think that was just our motto. So like every conversation that became very difficult of, oh no, we can't do that, or we have to do this, or this partner's not willing to do, this, speed up their processes to get there. I think, very quickly our motto became leave no eligible COVID-19 patient behind. And it's just something that like we say it now during our team meetings, every time there's a tough call around, are we really doing the right thing? That is just really like our rally cry. And so what I would say early on, number one is, let's face it, COVID's changed a lot. So, if you follow I'm going to call it the alphabet soup of COVID variants that are currently in existence, we've seen them move, thankfully, from more incredibly harmful variants to ones that are more mild. But the biggest challenge that lies there is, to your point, there's around 275 million Americans who unfortunately could have the mildest of symptoms, but they have an underlying condition. It could be just age, just being 50 years of age, or potentially having diabetes, being a little bit overweight. Those are types of criteria that unfortunately, that for those patients, even if it is a mild variant, even if you do have mild symptoms, if you aren't seeking treatment from your healthcare provider within those first 5 days, you could be one of the patients that finds yourself either in the hospital, in the emergency department, or struggling with, that disease that could have been mild becoming more moderate to severe. So our first goal was like, how do we make sure all these people know that even if they don't feel really bad, it could be bad, and not putting a negative message out to motivate folks, but actually trying to encourage them. And then our second thing was, hey, let's face it, we all wake up in the morning. We've got all the things that we have to do to run our lives, to run our households, to be there as a caregiver, as a parent, as a family member. And the one thing that we don't want is any type of illness getting in the way. We want to just get on with it. And so that was our second goal, was one, make people aware that even though they might not feel very bad at that moment, that taking action would be important. And then two, when they do take action, that it's just seamless. It's easy. They don't have to take out a lot of time during their day to go on a hunt for treatment. So pretty daunting challenge, but I'm just incredibly proud of where we've come, and even more excited about maybe where we'll go.
All right, let's pick apart this like frictionless model that you've built, more or less, because I think that's really, to me, part of the innovation story here. I mean, and this is not all about just technology. There's some really, innovative partnerships that have been designed as well. But let's start with the tech, because I love to start with the tech. So talk to me a little bit about, some of the technology that you put in place underneath this, because like you said, I mean, the challenge is not just like, oh God, how do you make it easy for people, but how do you do it fast so that, like, in that time frame where they need to, from the test, get a hold of the treatment so it has its max benefit? How do you do this? And tech is an obvious answer, right? And you guys are using all manner of things, right? So virtual care, I mean, different types of, digitized treatment pathways. You've even got some cool partnerships with some of our digital health friends, Ada Health and Q Health. So tell me about the technology behind all of this, JoyL.
So I think that was the first thing with this whole motto of like, leave no eligible COVID patients behind. I think we quickly realized that we were going to be leaving people behind if we couldn't bring people along with us, and those were our partners. And specifically, early on, we were not looking for companies who had every single solution, who had every single thing figured out. We might have needed a piece of that platform to be able to make these things come together. But in selecting our partners, there was one thing that was definitely at the core, which is their motivations for kind of that leave no COVID patient behind had to be in sync with ours. And I think that went a long way for people that we started to be partners with, where maybe it didn't exactly work out, to folks like you mentioned that we're still partners with. So I'll just kind of walk you through. Q Health was one of our first partnerships. So, I mean, talk about a revolutionary platform. They have this connected device. It can plug into your phone. You can do a test. It has PCR quality. It can upload to your physician. You can seamlessly link in to get treated by, a healthcare provider, and then also get same day delivery of your prescription. So when you think about enabling, not just, I would say, some of the partnerships early on, like the DoorDash or the Uber Eats delivery of like your prescription, but when you actually think about on the front end, having that screening so that it's instantaneous. I don't know about you, but my phone is the first thing that I look at in the morning. Unfortunately, maybe it's the first thing that I'm putting by my bed at night before I fall asleep. And so Q was an example of a great partner that we're partners with that has this seamless journey. Ada Health, we kind of got linked up to, and I'm really proud. Ada is our first partner that's not only available across all 50 states, but also in Germany. So that just happened last week. So we're able to treat patients globally. And we shared with Ada, hey, we kind of have this challenge that people don't really want to be labeled as high risk. They don't want to think of themselves of, I'm 50 years of age. That means I'm high risk. Or maybe I suffer from depression or another mental illness. I don't want to think about that as being at high risk for progressing to a severe disease. How do we inspire those patients to not only know their risk status, but to also be empowered by that and know that if they get COVID and their symptoms are mild to moderate, seeking care will be an easy journey. So Ada Health and our partnership with them is at ada.com. It's this seamless journey to, number one, find out, hey, am I one of the 275 million Americans who's potentially at high risk? So therefore, if I get the sniffles, I think it's COVID, I should probably seek treatment. I should go talk to my provider. I should test. So Ada Health seamlessly links you at ada.com to knowing if you're at high risk. And then they just ask you a very simple question. Have you tested yourself? Would you like to use one of our many telehealth components? And that was another pivot point with Ada. We didn't want to just make one telehealth, send all the patients to just one telehealth engine. Number one, it didn't feel like that was going to be probably the most patient-centric thing to do. But second of all, look, telehealth at that point, every company was popping up. As soon as one would come, another would go out of business or consolidate. So with Ada, I'm really pleased, I would say at the like Q, I'm pleased with the connectivity and just how innovative. With Ada, it's really been a sustainable engine, making that sustainable solution to know if you're at risk, know if you want to test, be linked into a telehealth provider, and most importantly, we also use just a website called No Plan Go. We had a couple of celebrities help us talk about their high risk condition and link to it. And that was also a big motivator for tech, also, in terms of influencers and folks that follow, famous people and want to know about their COVID journey. So those pieces coming together really helped us to get those two critical components of don't just know if you're at risk or not, but download that app, keep it on your phone, make sure that whenever you feel a sniffle or you think that you may have been exposed to COVID and you have symptoms, that you can get treated pretty quickly.
I love that. And I love hearing, your perspective on what you like about each of those different providers of technology, because I think that helps, those of us who are on more of the tech side understand, from a business decision-making standpoint, somebody like yourself at Pfizer, like, what are you looking for and what factors matter to you? So thank you for sharing that piece as well. I want to hear, speaking of technology and wanting to hear like, how this is all coming together inside a big organization. What were some of the big hangups with tech integration? Were there any? I mean, were there ever any moments where it was like, okay, we've got some concerns here, JoyL, like, I don't know what you're doing integrating technology into this part of the patient journey here, but this sounds a little scary? Because I mean, I think, one of the things that COVID inspired, I think, for a lot of us was to redesign more of an omni-channel strategy in terms of both communicating with patients and healthcare consumers, but also treating them. So you talk to me about that tech integration. How did that go? Did that go all right? And where were there hangups? What went smoother than you thought? Let us in a little bit on let us be a fly on the wall and listening in on some
Yeah.
of those Zoom conversations.
Yeah. So I'll tell you, one of the things that went better than expected was this notion of, I kind of just picture, because I am not the biggest tech person in terms of, I know what I want to see on the end, but maybe not how it all fits together, of how everything is integrated and how it happens seamlessly. And so I just know that there were lots of people working on it, but from a like digital perspective, I would have to say it was really our partners who knew so much more about the interfaces, what needed to happen to make this work, et cetera. They really saved the day, because that is not something that we do across multiple other partners on a day-to-day basis at Pfizer. So that was like one of the biggest pieces that, for me, I was kind of like, is this thing going to work? What's going to happen? Is anyone going to go to these websites? What's that going to look like? So I think that was a big, aha moment for me of something that went really well. The thing that I would say, in the beginning took a little bit more time was kind of trying to make sure that we were being very, very upfront and honest, not going too far into partnerships where we only needed certain pieces or certain components, and not just doing things just because they were cool or they were innovative or we thought this, technology was really cool and fun. And so bringing our partners along with that leave no COVID patient behind, and just making sure that, it sounds like just maybe a no-brainer from a business perspective, but that for partners approaching us, they knew like it's not just about the tech, it's about what's the personality style of that company, what are their values, how do we see ourselves engaging with them, and also what are they going to be doing on their own, agnostic of their partnership with us, to bring something great to market. And I'll give you one example there, which is in addition to this connected health journey, our goal is, the worst possible thing is for someone to take a COVID test, it's positive, and then they're immediately like, what do I do? Do I wait it out? Do I seek treatment? And so Roche has been a fabulous partner for us. So, we partnered with them. They have this global scale across consumers, even point of care testing and diagnostics, where, if you're positive, you can scan a QR code on your phone and it can link you into, seeing if you're at high risk, taking a look to see if treatment, you're eligible for treatment. And that was a great partnership of, they had the right capabilities. they had something that we didn't have at that point in time, which is, we weren't putting a Pfizer logo on every single COVID test. But yet we didn't want patients to kind of be in this lurch of, I've got a positive test and now I'm not sure where to go, or I have to, it needed to be more seamless. So I would say those were the big kind of learnings of just making sure you know what you're signing up for. There's a fair exchange of value, and your partner also, really understands what kind of what they need to do on their own just to make that grow and flourish, agnostic of their partnership with us.
Following up on that partnership conversation, I mean, that's the thing that's really cool to me is that you guys partner not only with these like little heart startups that are scaling, but also, massive healthcare companies, from around the globe. I mean, you talked about Roche, and I know you've had some partnerships with retail health providers here in
Yeah.
the US. I'm curious to know, like, I mean, a lot of my audience can sympathize with sometimes the challenges of building those partnerships in the first place, especially in healthcare. I mean, it's sometimes very difficult. What's your best advice for even just starting those conversations out? Like, how do you go to Roche and say, hey, we want to use you for just this piece? Or how do you have that conversation with the digital health startup of like, okay, we just want to start out like this, and is it going to work? And have some of those difficult conversations where you're cross pollinating, which is so important in innovation. What's your best advice about what to do, and also maybe what not to do?
Yeah. So I would say what to do is listen about twice as hard as you think you need to. So there's a great book. It's by a lady named Alex Carter. It's all around negotiating. And she has some of the most fabulous tips, I think, for anyone who's making a pitch or accepting a pitch on how listening to what someone really truly needs is the most important thing. And I will say, for all of the companies that we worked with, we might have started in one position, which was, hey, let us tell you about this fancy new technology that we have. But where we ultimately ended was just one slide with our patient journey. This is what we want to do. This is what it currently looks like right now. And so everyone kind of gravitated towards that, but it was helpful for us to outline that. I mean, that was a helpful exercise. It was also helpful when it came to, the red tape of establishing the partnerships with these companies, because we have to make sure there's value exchanged in the right way, that we're building this to last, and that we're going to know or have some key performance indicators to show, hey, if this isn't working and it's not helping us to both get to our outcomes, then was it a fruitful exercise, but we're ready to part ways amicably. And so I think the humility to go into with a potential partner, that companies came to us, the ones that we partner with, to say, I think if maybe a few might have, but most came in with, we want to be your partner of choice. And ultimately we were like, we want to give the patient journeys, that's our number one. And so we're going to have multiple partners, but we want to understand your services. And we also want to make sure, just like anything else, that it's a real match. So it's a little less on the technology side and a little bit more on what our ultimate goal was.
I like hearing that. And I think that's an important lesson in terms of just the relationship building around partnership, and how to do that, and do that in a way that's beneficial for everyone involved. I want to understand a little bit more about this single patient journey slide, JoyL. I've got to ask about this now. I mean, because that to me I love, and I love it because you started out talking about how you wanted to take the friction out of the whole process. So somebody's sick and they just want to get treatment. How do I make it just as easy? And you have this single slide. And so I want to understand your thinking around that, because this is one of the big challenges, I think, in healthcare, no matter where you're at in the ecosystem, is how do you take some of that fragmentation out of the patient journey? And so I'd love to hear your thinking about, what some of the challenges were, especially when you have multiple partnerships, multiple ways in and out of the patient experience. And if specifically you're dealing with patients who, yes, right now they may have COVID, but if they have a chronic condition, oh my God, that's a whole other, set of care. How are you integrating this stuff? So tell me a little bit, please, about, how you guys were thinking about making sure that that patient experience wasn't fragmented. What can we learn from you guys?
Yeah. I mean, so I'll tell you a little bit about what our slide looked like in terms of where it was and where we wanted to go. But then also, I think there's just so much unexplored territory for how we might want to think about this in other disease areas. So our journey was basically one of, we knew if a patient had a prescription written for an antiviral, they were getting it filled, whether it be our product or even a competitor's product. We knew that we weren't losing patients at that critical moment. But unfortunately, when we backed that patient funnel up and we started to think about how many patients potentially were testing at that point, as you know, we weren't really capturing anyone testing at home. And then what was motivating them to seek care? Oftentimes, they could have had a child that came home from school and they had to stay home from school because they had COVID, and the whole house had to be tested for COVID. Or, it was other, what was like kind of eye-opening was it wasn't like people, more often than not, especially in more frequent days, were just randomly testing themselves. They were testing themselves before they went to an event. They were testing themselves if they had been exposed, or maybe their kids were home from school, et cetera. So we were trying to use what we saw already happening and turn every single one of those patients into, how can we give them a nudge, a touch point? And at Pfizer, one of the things that I know that we can do, that we do really well, is through our medical and scientific expertise, is create the groundwork so that patients are informed. But we do it in a way where we take our marketing, and we do have to do marketing differently. So even though we used what I would say were some traditional channels, we also used marketing efforts such as billboards, direct, mailings in zip codes to say, hey, did you know that there's treatment available if you happen to test positive? And so we really tried to come at it at ways that are not going to sound in any way digital or new or innovative. But I say that because that is what helped to make it top of mind, so that these partnerships that we have could be utilized. So I do think it takes both, to make that difference. The other piece that I'm just really proud of is slowly we've been able to make a dent in terms of the number of socially vulnerable communities that are using telehealth solutions. And when you think about all of the barriers to healthcare that some folks face, whether that be just disparities of care, not living near a healthcare system, technology was not the thing that was the barrier. Technology was the enabler. So most people had a cell phone. Most people were able to use it. Even if they didn't live near a physician office or a pharmacy, they knew how to use their phone. And that was something that we were able to tap into. So that's just a little bit around, our patient journey. We knew once they were prescribed, they'd get the medicine, whatever they were prescribed, but we were just losing people on the first half of that funnel. So that's what our pitch to the other companies look like. But I'll tell you what excites me the most is where we want to go. So, just imagine you wake up and you don't feel well. You don't know what you have. Is it COVID? Is it flu? I mean, we hear a lot about RSV and other viruses these days. And so I can imagine a future in a world where it's a seamless transition of, if you're not feeling well, you're instantly going to know like what it is that you have. How can you best take care of yourself? Almost as seamless as what I call, I've got a headache. I need to go find an ibuprofen, or I need a Tylenol. Those levers so much better and easier. And I don't think there is a boundary. I mean, I know we have a partnership with an AFib with Fitbit to think about how do we monitor for patients' heart rhythms, and if something's out of rhythm, to maybe send them a signal that they need to go see their physician. I mean, just think about that for a moment. That's just such a huge revelation. And so I really feel that if you look across our portfolio, it could be in oncology, it could be in specialty care and inflammation, it could be in the field we're in with viruses and vaccines, but what better way to just think of that patient journey, insert, the technology that could be helpful, and try it. I mean, for every single time you fail, hopefully you've learned something with that partner so that you'll succeed the next time.
All right, last thing for you then. Okay, so I can't imagine that all of the work that went into designing this model is just going to be, left in one place here at Pfizer. I can't imagine that this isn't going to be replicated across divisions and treatment areas like you just, painted a beautiful picture for. And so, I'm curious, the last thing for you, how do you think this model that you've built, how it will take hold across the organization, and how you think that it's really reshaped, patient expectations for the patient to Pfizer relationship moving forward? I mean, what's ahead here for us with you?
Yeah. So, I mean, we made some internal changes, which I think have been beneficial. One was, kind of internally going with the chief marketing office here at Pfizer that really has inspired us to get even closer to the patient. And patients of different disease areas, of course, behave differently based off of their comorbidities, et cetera. But at the end of the day, human behavior is always going to be such a huge determinant of care. How are things in my path as I'm going along my normal day to make decisions? And so what I would say I'm excited about is that internally at Pfizer, we've always been focused on that patient. But now we're not just focused on the medicines, but we're focused on solutions for patients. So that's one, I would say, internal shift that we've taken through partnerships like the ones that we've mentioned today that I really think are going to be the biggest difference for us moving forward. And then whenever you look at, especially communicable diseases that are just so widespread, I don't know of any other better place to try some of the latest and greatest technologies. But for me, it's the patient, and just figuring out those attitudes and how patients behave of all different shapes, sizes, walks of life, how we can meet patients where they are. It's not enough to say, yes, I'm going to give you this solution to take a test and this solution to get treated, and then this solution to help you figure out where the product is, and then this solution to help you go get the product or get it delivered to your home. Making that just one seamless, experience is really our utmost goal.
That's really revolutionary. I'm blown away by that, and have all of the encouragement in the world for watching to see that happen, because it
Yeah.
really does bring the patient closer, to Pfizer and to the treatment that you have available to them. So we look forward to watching more of these types of patient engagement platforms and consumer engagement platforms be built and help expedite that journey between test to treatment or testing to care. So thank you so much, JoyL, for explaining how this all played out, especially around COVID treatment, and what we might be able to see in the future coming out of Pfizer. I really appreciate hearing it.
Thank you. This was such a great conversation. And look, I can't wait to just continue to hear more from your other guests. We're always open to new ideas, new partners, as long as we keep, I think, that patient journey in mind and think of how we can make it easier. So this has been great. Thank you for spending some time together, Jessica.
Thank you so much, JoyL. And you better watch out. Your inbox is going to be flooded with emails from people.
That's okay. That's okay. All good.
Tech-savvy entrepreneurs are very good at hello. Thank you
You're
so much, JoyL,
welcome.
and appreciate your openness to not only talking, but also to hearing these ideas. So thank you again. For
Absolutely.
more interviews with those who are shaping the way that we do healthcare, head on over to my YouTube channel. JoyL, you too can head on over there. Watch a couple of these companies as they pitch you. It's youtube.com/WTF Health. I'm Jessica DeMassa. Again, that was JoyL Silva from Pfizer. Thank you again for joining us. We'll talk to you guys real soon. Take care.
Thanks.